Hi, my name is Nicole Vipperman and this is my sterile wound change. First, I would identify the patient using two patient identifiers, name and date of birth. I would use the 11 rights of drug administration. I would follow all GPSP procedures and protocols, and I would assess the patient for allergies. I would also assess the patient for pain. For this video, we're going to assume that my patient's in no pain. If the patient was in pain, I would check the orders to see if there was pain medicine. If there was pain medicine, I would administer it, and then I would come back 30 to 45 minutes later and reevaluate the patient. Okay, so this is my sterile field. We're going to assume that this kitchen table is waist high and that everything I do is above the waist. This is my sterile field. This is my wound. So first, what I would do is I would do hand hygiene. I would don a pair of gloves. Okay, I'm going to remove the old dressing by using the push-pull method. I'm going to start with the outer edges, work those loose. Then I'm going to pick up the dressing. I'm going to taco the dressing. I'm going to taco and evaluate the wound. I'm going to get rid of the dressing. I'm going to get rid of my gloves. I'm going to perform hand hygiene. I've got my dressing tray here that is sterile. I'm going to check the lot, the expiration, make sure that it's not opened, make sure that it's not tampered with at all. Now I'm going to open the dressing tray away from me, and I'm going to tuck the paper underneath. Not touching anything on the inside because it's sterile. I'm going to do hand hygiene again. Okay, now I'm going to get my sterile gloves, and I'm going to pull my sterile gloves over, and I'm going to open them, staying within the 1-inch border. Okay, I'm going to take my first glove, and I'm going to step back. I'm going to put my hand in, and I'm going to work the glove over my hand, okay, pulling from the outside cuff. Then I'm going to keep my thumb out. I'm going to put my hand in my other glove. I'm going to work my hand in my other glove, keeping my thumb away, pulling it down on. Sterile can touch sterile, so I can now go into the cuff of my glove. Okay, I'm going to discard the paper. I'm going to get my swabs, and I'm going to clean the wound. I'm going to start with the inside first. Dispose. Start from the right side. Dispose. Left side. Dispose. Okay, now I'm going to dry the wound. Okay. I'm going to dry the same way that I cleaned. I'm going to dry from the inside, dispose. I'm going to dry from the right side, dispose. I'm going to dry from the left side, dispose. Now I'm going to take these sterile gloves off. I'm going to perform hand hygiene. I'm going to don a new pair of gloves, new pair of sterile gloves, staying working within my 1-inch border again. I'm going to open the gloves. I'm going to pick up my first glove. I'm going to step back. I'm going to work my hand in. Okay, and then I'm going to pick up, keeping my thumb out, I'm going to pick up my second glove, work my hand in. Okay, now I can fix the cuff of my glove. Dispose of the paper. Now I'm going to get my sterile dressing. I'm going to place it over the wound. I'm going to take my gloves off. I'm going to tape the dressing. And then on the tape, I'm going to write my name, the time, and the date. Then I'm going to perform hand hygiene, and then I'm going to report and record. Thank you.